So if we're trying to find out if the nervous system is working, ask the patient if they can voluntarily move that muscle. Right? If the muscle responds, that means that the nerve that's sending a signal to the muscle and releasing the neurotransmitter is intact. Yes?
What about, there's been times like where I've slept on my neck wrong and it's like it's a stiff neck, I can't move it to one side, so does that mean the nerve was damaged or it was just,
No, it's just the position.
Just the position?
It's just the position. The thing is that once that muscle warms up, then you'll be able to kind of move it again. All right? Any questions? All right? So let's go through the moves. Okay. Remember, you have to know the muscle tested, and you have to know the nerve. So for our next exam, we have the oral portion, we have multiple choice, we have slides, and we have muscle test. How am I going to test you with muscles? You'll have a card, and the card will say forearm flexion. Okay, 2 people are going to come up at a time. So if your test is forearm flexion, you're going to perform this test on your partner that comes up. Okay? Once you perform the test, on your form, you're going to write under muscle tested, it is a bicep brachii that was tested, and we're testing the musculocutaneous nerve. Right? So you have to know the muscle, the action, muscle tested, and the nerve. Right? Any questions about that? Okay, so what we're testing here is basically the nervous system. All right? So can I have a volunteer so I can run through these muscle tests? So if we're testing head flexion, remember it's the sternocleidomastoid muscle that we're testing, and it's the accessory nerve that's working. I want Nita to perform a function. Okay? When she performs a function, I should feel the resistance. That lets me know that the muscle is working. Okay? So in order to test head flexion, I'm going to put my hand on your forehead, and I want you to push forward. Okay? So I can feel the resistance. That lets me know that the sternocleidomastoid is getting a signal from the accessory nerve. Right? Yes?
Do you have to record this?
Of course. Students do it all the time. Okay? So head flexion. Once again, how you're testing it, push against my hand. So her neck is going like this, okay? And I can feel that resistance. All right? So if Nita was actually, not I'm just using Nita, if Nita was laying on a gurney, okay, and there was an accident, maybe there was a cervical accident, okay? While she's sitting down, while she's laying down, I would tell you to push up. Right? And if she can't do that, then I would know that the accessory nerve is not sending a signal to the sternocleidomastoid. Okay? So then when I actually do my MRI, I'm looking at that accessory nerve to see if it's damaged. All right? Any questions about that? Okay? Head extension, I'm going to push up and you push back. Okay? So I can feel the resistance. Okay? With rotation, I'm going to push your face toward the left, and you push against my hand. Okay? So you're pushing, you're turning, you're rotating. Okay? Push. Good. Other side. Push. Good. Right? Rotation, sternocleidomastoid, accessory nerve. Forearm flexion, 90-degree angle. Okay? So what I'm going to do is I'm going to push down, and you push up. That's flexion. I can feel the resistance. All right. Same position. Okay. I'm going to push up and you push down. That's extension. So what she's trying to do is extend the arm, and I can feel the resistance. That lets me know that the muscle and the nerve are firing. Okay. Opponents. Opponents is basically taking your thumb and your digit minimi, which is digit number 5, and you're going to put it together like this. Okay. I'm going to try to pull your fingers apart, and you don't let me. Okay? So I can feel the tension. That lets me know that the muscles are working and the nerves are firing. Okay? Next one is leg flexion. So with leg flexion, okay, remember, you flex and extend. Flex and extend. Okay, so with leg flexion, I'm going to push up, and you push against my resistance. That's flexing. Extending, I'm going to push down, and you push up. So the nerve is firing, the muscles are getting the signal, they're contracting, I can feel it. Right? And then the last one is plantar flexion and dorsiflexion. Raise your leg up. This surface of the foot. This is the dorsal surface of the foot. Okay? So if she's plantar flexing, I'm going to push down, up, and you push down. Okay? Like pushing on the gas pedal. Plantar flexion. Okay? Dorsiflexion is the opposite way. So I'm going to push down, and you push up. Okay? So that lets me know when she's dorsiflexing, the fibular nerve is firing, and the tibialis anterior is contracting. So there's no problem. Okay. Any questions about that? Okay. Flip on over to lab assignment. Say their name. Say their name. Flip on over to lab assignment number 6. We're going to do biceps tonight. I'm sorry, reflexes today. Okay. So with reflexes, there's 4 different reflexes we're testing: Achilles, biceps, patellar, and triceps. So what you're going to do for reflexes, you're going to write the student's name. If you get a response, it's positive, and if you don't get a reflex response, it's negative. That's all I want. All right? When you're testing, the card will say Achilles reflex, and you are to perform it. All right? So let's do these reflexes. I'm going to have you sit here. Okay? Put your knees in. Put your knee in the chair like that. So what we're going to do is we're going to tap on the Achilles tendon. When we tap on the Achilles tendon, what's going to happen is the signal is going to go to the spinal cord. Okay? Spinal cord is going to interpret it because this is reflex. And then the signal is going to come back, and we're going to see our foot respond. Okay? So what we're testing is that spinal cord segment. Under the Achilles, if you flip over to the page before, the segment that we're testing is S1 and S2. So if the Achilles reflex is intact, meaning that she responds, S1 and S2 are intact. There's no injury. Okay? So what we're going to do, you may have to stand up so that you can see it. So what we're going to do with the blunt end here, okay, we're going to tap on the Achilles and watch your foot respond. Okay? Can you see that? You guys see it? So what's happening here is she's doing that. Okay? That's all the Achilles reflexes. All right? Have a seat for me. On the sit here so you can see. Okay? The next one is the biceps. So the bicep reflex, what you're doing is, first of all, I want you to palpate your tendon. The tendon is in the antecubital fossa. Okay? So when you flex and extend your arm, that tendon pops out. Okay? That's what you're striking. So it's like Nita and I. It's like Nita and I are shaking hands, but I'm going to go past her hand to the antecubital fossa. Once again, it's like Nita and I are shaking hands. I'm going to go past her hand to the antecubital fossa. Okay? I'm going to put my thumb on that tendon here because I want to protect it. It's tender. And I'm going to tell Nita to relax her arm. Relax. Make it heavy. Good. So what I'm doing is that I'm striking my thumb with the sharp end or the pointed end, okay? But I'm not directly striking the tendon because that will hurt. All right? So protect it with your thumb. Relax. Relax your arm. Make it heavy. The only thing that's happening is this. Okay? Some people, you will see their hand actually go like that. It just depends. Okay? So it's just a response. What that's saying is that the response is starting here, goes to her spinal cord, comes back, and the muscle responds.
Can you do it on the other side?
Sure I can. Okay? So it's like we're shaking hands. Okay? Go past her hand like this. Okay? And basically what you're going to do is just tap. Okay? Nita's whole body's responding. When you tap, it's just going like that. Okay? And like I said, sometimes you'll see the hand will go like that. It just depends. So you're looking for that response. In kids, it's ever so slight. It's really quick. Okay? Triceps. With triceps, what we're going to do, this is the olecranon, your elbow, and you're going to go right above the olecranon. There's a little indentation here, and you can feel it. You want to palpate it first. Okay? Relax your arm, Nita, make it heavy. Okay? And then what you're going to do is you're going to actually strike in that region. See your arm? Right. That's your reflex. Okay? Yes?
Is that where you hit your funny bone?
Yes. So that's right. So that's your a nerve, your ulnar nerve. Okay? And the last one is the patella. Patella is the kneecap. What you want to make sure is that this individual or this patient, if me as my patient, is not wearing a knee brace or there are no injuries. So you would ask her, are there any injuries? Okay? So then what you would do for the patella is you're going to palpate the patella bone and you're going to dip down right underneath the bone because we're actually hitting the tendon, not the bone. Okay? So you have the bone here and the tendon lies on top of it right here. Okay? You're hitting the tendon. Okay? So then what you're going to do is you're going to palpate. Now a lot of people are really ticklish. Okay? So you still have to do your reflexes. You still have to do your physical exam if a person is ticklish. One way to distract them is for Nita to put her hands together like this and try to pull your hands apart, but don't. Okay? So you're creating pressure here. So she's focused here while I'm doing her reflex. Okay? Men, make sure you do not stand like this, okay? Because some people have really strong reflexes. Okay? And then we'll kick you. Okay? Also with the reflex, I've seen this happen. You don't have to come all the way out here, okay, to do the reflex. Okay? Nor do you have to do like this. I can't get it. Okay? You don't want to do that either. Okay?
Yeah.
Just try it a couple times. If you can't do it, we'll try to do the other way. Alright? So Nita, hold your arm like this. Relax your legs. And what you're going to do is the patella tendon right underneath. You're going to palpate. Okay, there's the response. Okay? So what happened is, sorry, the signal started here, went to the spinal cord, came back, and the leg extended. So let us know that the spinal cord is relaxed. Spinal cord is intact. Okay? There's no injuries. All right? Thank you. Thank you. Any questions about that?
And what if we don't have a reflex anymore?
If you don't have a reflex, then there's a lesion in the spinal cord. There's something going on in the spinal cord. Okay? Also with the Achilles reflex, I forgot to mention that. With the Achilles reflex, if a person has hypothyroidism, this is a test question. If they have hypothyroidism, the Achilles reflex is slower. So with the Achilles reflex, what you're getting is a response like this. Okay? If they have hypothyroidism, what happens is that the reflex is much slower. Okay? Any questions? Okay, so we're working on lab assignment number 4 and 5. Don't forget to do your reflexes. That's in lab assignment number 6. Okay. So get amongst your group and finish your lab assignments, and then we'll do presentations in about 20 minutes or so. Okay. Any questions? How many of you need the internet to do your presentation? Anyone? Internet? Yeah. How many of you need speakers?